Treating pain without medication or surgery. That's the promise of this new handheld device. I'm health reporter Anita Brickman. I'll have the story coming up.
Few things can be as excruciating and consuming as chronic pain. Action News health reporter Anita Brickman is with us with a new pain treatment that is helping some people reclaim their lives.
Exactly, Jim. And those who say this treatment helps include one high-profile pain patient, former 76er Todd MacCulloch. He's actually responsible for bringing this unusual therapy to our area.
Let's see what we got going on here in the foot.
A rare nerve disorder sidelined Todd MacCulloch from professional basketball back in 2003.
MacCulloch, Townsend against Grant, got it.
He has a constant pins and needles sensation in his feet that sometimes gets so strong he can't wear shoes. The one thing that has brought him some relief, this device called the Fenzian treatment system.
As it's getting stronger, feeling a little bit coming down into the foot.
Neil Liebman has been the Sixers chiropractor for the last 16 years. MacCulloch actually asked him to get trained in using the Fenzian device after visiting its creator in England.
He was very skeptical at first and really didn't think a former basketball player would be able to give him any hints on something that could help his patients.
Now MacCulloch is one of many who come to Liebman's office for the Fenzian therapy. Basically, it works by sending an electric current to the nerves below the skin. Liebman says the Fenzian machine reads hot spots where the nerves are firing off repeated pain signals. Those signals make the muscles around the nerve spasm, which only increases the pain.
If you decrease the frequency of the firing of the nerve, then the muscles can relax, which takes away the pain.
It worked for Lenny Silverman. Scarring of the nerves around her spine had left her debilitated and desperate.
I was taking Vicodin every 3 to 4 hours.
After 8 Fenzian treatments, she stopped coming because it didn't seem to be helping. Then one day, the pain began to fade.
I have not had a Vicodin since before Thanksgiving.
Others, like Peg Brown and Ethel Williams, have similar stories to tell. Williams was actually referred by her orthopedic specialist when steroid injections didn't alleviate the sciatic pain shooting down her legs. Dr. Jack McPhillamy says while the science behind the Fenzian technique is sparse, he's willing to have his patients try alternative therapies.
As a physician, we almost have an obligation to try all non-invasive treatment options or modalities prior to recommending something invasive like surgery.
Of the patients Dr. McPhillamy referred for Fenzian sessions, some got significant relief, others did not. As is often the case with something as subjective as pain, he says electrical stimulation of nerves offers mixed results. Some, like Lenny, respond quickly. Others, like Todd, get more subtle improvements. He may never get back on the basketball court, but he can stay on his feet longer than he used to.
When you're desperate and when you're in chronic pain, there's nothing you'd rather be than just to feel normal again and have my feet feel the way that they used to.
Hopefully that will happen for him someday. A typical course of treatment with the Fenzian system is 3 times a week for about 4 weeks. If patients don't improve by then, Liebman says he suggests they move on to trying something else. Cost per treatment is about $65. It is covered by insurance in some cases. Sometimes it is not, Jim.
And so the verdict is still out as far as...
It is one of a host of modalities people try when they're dealing with pain. Again, this is a very subjective problem. Some people feel pain a lot more strongly than others,
right,
depending on their injury, depending on their nerve sensitivity. There are people who believe this has helped them.
Good.